The Minnesota House is scheduled to vote today on a health omnibus bill. This does include a public option to expand affordable health care coverage to more Minnesotans, including immigrants without status. So ahead of today's vote, Minnesota doctors and patients spoke out in support of the measure and explained why they believe it should move forward at the Capitol.
Physicians across Minnesota are calling on our legislators to approve a public option to expand access to affordable health care to all Minnesotans. And furthermore, we'd urge them to include immigrants without status. As physicians, we firmly believe, and our experience often confirms, that when everyone in Minnesota has access to affordable quality care, we all do better. Every day we see how when people get the affordable preventative care they need to remain healthy, they keep serious health conditions at bay. They visit their doctors regularly instead of being forced to end up in the ER where care is more painful and expensive and urgent. Physicians also see firsthand how sickness and injuries don't care about zip codes or immigration status. We see how immigrants in Minnesota with no access to care often delay treating an otherwise manageable condition. Undocumented workers do many jobs that are essential to all of us, from meat packing to manufacturing, from cleaning to construction, yet they disproportionately are excluded from getting access to affordable health care. The Minnesota Care Public Option is an opportunity to remedy this gap and help ensure that more Minnesotans can stay healthier and productive, regardless of who they are or where they're from. And for this reason, Minnesota physicians call on the state legislature to pass the Minnesota Public Care Option for all. We have written to legislators urging them to approve a Minnesota Care Public Option that everyone in the state can access. This legislation will ensure that more Minnesotans can qualify and buy into Minnesota Care, the state's basic health insurance plan, without breaking the bank.
Over the past several years in my training and experience seeing patients, time and time again, one of the most heartbreaking things for me is knowing that in this country, we have the medications and resources to treat someone, my patients, effectively, and yet not being able to provide it as an option for someone due to cost or lack of insurance coverage. I would hazard a guess that all of us probably know someone or even have ourselves foregone or delayed medical care due to fear of potential costs. I know I certainly have. And I see this at least once a week where a patient tells me that they don't want to come back for a follow-up visit or undergo necessary testing because of the nature of their insurance and what their potential out-of-pocket costs might be. Recently, I was involved in the care of an older, undocumented gentleman with suspected advancing cancer who came to the emergency department due to severe pain. And despite everything going on, he eventually declined getting worked up for this potentially treatable cancer. And what he told me was that he couldn't bear the thought of burdening his family with medical debt. And these stories and situations span across every field of medicine I've ever rotated in or been a part of. And the patients behind these stories are just as diverse in situational background and socioeconomic status. And I will note that this piece of legislation has immense public support. In fact, 91% of surveyed Minnesotans believe that the government should expand insurance options so that everyone can access quality and affordable health care. Family farmers, small business owners, artists, entrepreneurs, and retired Minnesotans all have joined healthcare professionals in supporting the Minnesota Care Public Option.
It's hard to describe my parents because to me, they are real life heroes. My mom and dad were both born in Mexico in the same year of 1963. Both are born to a working class family and had to find work at a really young age to help their family. My parents tell me that their lived experiences with struggling with money for food and other necessities like clothes and shoes. Those necessities shaped my parents and their work ethic. When my parents came to the US in 2004, they began working in the hotel industry. And within a couple of years, they were in supervisor positions. All of that progress without speaking the language fluently. My parents came from nothing to creating a bright future for me and our family. In late 2004, my father was diagnosed with type 2 diabetes and hyperthyroidism, or overactive thyroid. My dad began losing weight at an alarming rate. At the time, he met with his social worker and was able to get healthcare to manage his disease and get healthy. I don't remember what coverage he got, but I helped him fill out. I remember helped him filling out forms, and I was a young kid. I must have been maybe 9 or 10 years old. it was like a huge weight lifted off our shoulders when he was able to get some sort of coverage. This coverage ended in 2006 when he was no longer eligible. We went from receiving preventative care and medicine to now having to afford medicine and different costs related to my dad's condition. There were times where my dad's diabetes levels for his blood sugar would reach higher than 300, but we were afraid of going to the emergency room due to the high cost and the fear of being denied for not having insurance. Mentally, we were depleted, exhausted of having to navigate such a difficult system and complicated system. If we want kids to be successful, then we must have healthy parents. You want healthy kids, give them healthy parents. Our immigration status should not determine whether we have dignified healthcare for our working parents, family members, friends, and neighbors. Let's not forget whose bodies were on the line during COVID-19. And yet through all of this, we still don't have accessible healthcare for those who were on the front lines during the pandemic and have secondary side effects. It's time to show up for our hardworking immigrants and grant them access to healthcare. We are asking the Senate to pass the House bill and expand Minnesota Care.